South Carolina health leaders are trying to figure out the best way to divide up the state's limited supply of COVID-19 vaccines. The state health department's board met today to talk about possible changes to the current plan. Our Jason Raven shows us what they're considering.
The DHEC board of directors did not take any action this morning, but we did get a better idea of what kind of impact a population-based allocation model would have here in South Carolina. During Thursday's meeting, DHEC officials shared with the board how that way compares to the baseline model they've been using for the last 9 weeks. They say if they were to allocate vaccines based on a per capita basis, it would direct a larger portion of vaccine to counties with less population.
This will do certainly is target those areas more so than we've been able to do thus far to those rural, minority, etc. Communities.
A senior deputy for public health, Nick Davidson, says this model would also require more partnerships with nearby vaccine providers to actually deliver the vaccine and more state or federal vaccine site support.
It will require more of tailored events, but frankly, if we're going to get out to those people who need it, we have to tailor to the needs that they have. That's what health equity is all about.
During the meeting, the board was considering changing the way the state is allocating vaccine, but before they took action on approving this change, the board went into executive session. When they came out, they asked if a model that distributes vaccines regionally would work.
Provide us more flexibility to meet the needs of the local communities, particularly because there are so many regional providers that we have, who some of them have a fair amount of, if you will, horsepower to get vaccine out into communities.
This is similar to what lawmakers are proposing in a vaccine relief funding bill that passed the Senate Wednesday. The bill is now on its way to the House after senators amended the bill. The board of directors decided to wait on making a decision, and they hope to get more details on the impact a regional per capita allocation of the vaccines would have during their next meeting. The next board meeting is scheduled for March 11th. From downtown Columbia, Jason Raven, 7 News.
DHEC says at this point, South Carolina is receiving about 76,000 doses of the COVID-19 vaccine per week.
The coronavirus